Number 8, the Honourable Ruth Dyson.
My question is to the Minister of Health. When will all the District Health Board annual plans for 2010-11 be publicly available?
The Honourable Jonathan Coleman.
On behalf of the Minister of Health, when they are all approved and signed, and it will not take until 11 months into the financial year to have the Auckland DHB annual plan approved, as I am advised it did in 2006 under her government. DHBs have worked hard on their plans to improve services while steadily reducing the $150 million gap of unfunded services left by the previous government.
Order. Now, I must be pretty thick or something, but the question asked, when will all the District Health Board annual plans for 2010-11 be publicly available? The Minister answered that quite quickly when he said when they're completed and signed. It's totally outside standing orders then to go on and make all sorts of negative comments or comments the member might wish to make about the opposition. I'm sure there'll be supplementary questions that give him more licence, but that primary question didn't. Honourable Ruth Dyson.
Supplementary. How does he expect candidates for the District Health Board elections, let alone the public, to make judgments about the extent of his budget cuts when he has still not signed off 15 of the 20 District Health Board annual plans, now 3 months overdue?
On behalf of the Minister of Health. Well, firstly, Mr Speaker, of course, there haven't been budget cuts. There's an extra $512 million going into health. Candidates for DHB...
Order. This time I apologise to the Minister. Now, the Labor Party spokesperson on health asked a question, to which I presume the Labor Party members wished to hear an answer. Now, the Minister, initially answering, disputed a claim in the Minister's question. He's perfectly at liberty to do that. But the interjection level was such that I couldn't hear any more of the answer. And I want to be able to hear the answer. I apologise to the Minister, but I look forward to the House hearing the answer. The Honourable Jonathan
On behalf
Coleman.
of the Minister of Health, Mr Speaker, of course it is absolutely misleading to say there have been budget cuts. An extra $512 million is going into health this year. As regards DHB candidates, they are well aware of the legacy of disaster the last government left them to clear up. In 2007 they managed perfectly well when the Labor government failed to sign off DAPs, and I'm sure they'll be well placed to assess the situation this time round.
Honourable Ruth Dyson.
Has he not signed off 15 of the District Health Board annual plans, which took effect from the 1st of July, because they all show cuts to services, which he would prefer remain hidden at least until after the District Health Board elections? Cuts like the $300,000 raid on mental health ring-fence funding on the West Coast and the $316,000 cut to non-government organisation services in Wairarapa.
The Honourable Jonathan Coleman.
Well, on behalf of the Minister, that member is once again misleading. In terms of mental health on the West Coast,
point of order,
there's
the Honourable Ruth Dyson.
The Minister just referred in a totally inappropriate and unparliamentary phrase in regard to me. I took offence at it and I asked that he be required to withdraw and apologise.
Order. It's an interesting point the member has raised, and normally the member is quite right that a member cannot allege that another member is lying or not telling the truth. To suggest that a member might be misleading the House especially with a statement made in a question. Questions are not meant to contain statements, and they risk a minister disputing the statement. Maybe on this occasion, because the member has taken offence, what I'd ask the minister to do is perhaps use other language to dispute the claim in the question. The minister is perfectly at liberty to dispute the claim in the question, but maybe not so blatantly claim that another member is misleading the House, to dispute the information perhaps in more appropriate language.
On behalf of the Minister of Health. Well, I think the House will be able to judge whether there have been cuts to mental health budgets on the West Coast. But the fact shows that an extra $12.6 million is going into mental health on the West Coast this year. In terms of Wairarapa, there's another $7.8 million going into mental health. So it'll be up to the House to judge whether that initial statement was misleading or not, but the facts stand for themselves.
Dr. Paul Hutchison.
Thank you, Mr. Speaker. To the Minister of Health, when did the Minister first approve a district annual plan?
The Honourable Jonathan
On behalf
Coleman.
of the Minister of Health. The first district annual plan I approved was after the general election in November 2008, when there were still 4 annual plans that the outgoing Labor government, 4 months into the financial year, had not signed off. These and the remaining DHB 2008-2009 annual plans projected a total of around $110 million of services being delivered but not funded. This was subsequently revealed to actually total over $150 million.
Honourable Ruth Dyson.
He signed off on the cut of $61,000 in tobacco control services on the West Coast, when the board's own report says that Māori are underrepresented in accessing primary healthcare services and have above average smoking rates.
The Honourable
On
Jonathan
behalf
Coleman.
of the Minister of Health. Well, Mr. Speaker, if you look at the West Coast, an extra $4 million going into health there this year. There has to be reprioritisation of services to meet the needs of the local communities against that background of increased funding. And I would remind that member that it was her government that cut 30,000 New Zealanders off elective surgery waiting lists. So don't talk to us about cuts.
Question number 9, Joe Goodhue.
Point of order, Mr.
Point
Speaker.
of order, Joe Goodhue.
Thank you, Mr. Speaker. I seek leave to alter the wording of this question to make it